In today's environment, it's important for healthcare providers to be thinking about the impact of out-of-pocket costs to patients. Over 100 million Americans suffer under the weight of medical debt today, and there's a growing expectation that they pay out of pocket in a way that they just simply can't afford. My organization's focused on that issue, and what we've realized is that there's a real distrust that's growing between physicians and their patients as a result of this out-of-pocket cost. I think it's important that physicians have a voice in their systems and say out loud and often, we need to do something about our billing practices. What's happening is that patients are avoiding care as a result of a fear of what it's going to cost them and their families to get that care. Physicians have a wonderful position to push their institutions to do better on this front and to be honest about the realities of how we finance healthcare in the United States, and that it is fundamentally unfair in putting patients in a very, very vulnerable position. When we work with hospitals and we buy the medical debt so that we can relieve it for patients, we give them an analysis that shows them how their financial assistance policies are falling short. We've seen some examples where they want to now do presumptive eligibility. We've seen cases where they increase the thresholds because through the analysis, they see that there's a lot of patients that are just above their current threshold that aren't able to pay. We see that they realize that their communication approaches and telling people about their financial assistance policies are falling short. And so I see some real bright spots in this system where once hospitals have that information, they are being thoughtful about how to come to the table in a more meaningful way for those patients so that they come back and get that care that they need.